Hi, it's Dr. Holly. Welcome to our final VIP session of our 3-day virtual healing event. It's been a wonderful journey with all of you. I hope it's been beneficial, and I really appreciate your time and energy here with me as we've spent this time exploring ways that we can engage in healing for ourselves, exploring how the power that we have within ourselves in mind body work and communication skills that we can be utilizing with our team and others as we take on this journey towards healing. All right, I am going to share my screen and we will get started. Okay, so for our special session today, we're going to focus on substances, supplements, and their effects on your brain. And this is really beyond brain, as I said. The mind-body connection is so strong that it's difficult to kind of tease it down to just one organ being affected, but I'm primarily focusing on the brain because it does influence the rest of the body in such a way. Okay, so let's just take a moment to do some deep breathing together. Just sitting with an awake spine, and if it's available to you, closing your eyes, if not, a soft gaze, and just inhaling through your nose and exhaling through your mouth, and just noticing your breath. You don't have to change it. You don't have to do anything different with it. Just noticing the inhale and exhale. Maybe noticing how it moves into your lungs. Maybe noticing where it first enters into your nostrils or exits through your mouth. Or perhaps you're drawn to notice the breath going through the entire body to different areas wherever it's drawn. Bringing nutrients, support, awareness. Just noticing. Bringing your attention back to that breath if it wanders. Just noticing it, allowing it to change and do what's needed to keep you going. And then bringing your attention slowly back into the rest of your body. And when you're ready, you can open your eyes. And here we are together, ready to take on this next section. All right, my loves, and just be prepared with any kind of questions. We can do a question and answer after this, or just remember I do have that discovery call that you can take part in if you have something that you want to ask one-on-one. You can find that at my darawellnessnola.com website, and the Thrive, THRIVE in capitals, is the coupon to get a free discovery call at any time. All right, so today we're going to be touching on micronutrients and how they help create your neurotransmitters, how inflammation, lifestyle, environment can contribute to cognitive decline and brain function, behavioral, diet, supplement changes we can make to improve our health, and then some integrated medicine strategies. Okay, so this is a little busy, but it's just to kind of get the point of a very simplified user manual to your brain. You will sometimes hear these different neurotransmitters and chemicals referenced by your medical team, or see them referenced in social media or wherever you may be looking when you're trying to figure out what's going on with your body. And this is just kind of a Cliff Notes version to help you figure out what all that means. So glutamate is an excitatory compound. It is helpful for learning, for gaining neuroplasticity. It's something that we work with when we are looking at working with different types of supplements, different types of substances that we use with assisted psychotherapies. It plays a big part in kind of helping us um, improve outcomes. And, if it's deficient, then we have different ways we can kind of address this depending on different uh, vitamins, minerals, what have you, to help increase it or decrease it. Because it is excitatory. So if it's too excited, we can kind of decrease it. If it needs a little pump, we can improve it in various ways. Dopamine is also an excitatory compound. It helps with motivation. It helps with cognition. It's that reward factor. So if we find ourselves kind of falling into the use of substances or addictive behaviors, dopamine plays a big part in that. Dopamine, again, is helpful for motivation, helpful for energy. So it's not a bad thing. But, like everything else, there's a homeostasis. We need a balance. So if it's too high, you can get into the space of hearing things, seeing things, or having difficulties with calming down. So, we use things to help with increasing, decreasing, things that can kind of lead to deficiencies or to increasing are utilized depending on the person's presentation. GABA is inhibitory. It's one that's really well known for anxiety. GABA we use both for pain and nerve pain, but also in the space of anxiety or insomnia. I'll use supplements that help improve GABA to help improve with sleep and calming of the brain. ACTH is the hormone that kind of goes from the brain and helps to stimulate cortisol release. So it's something that helps increase cortisol if you are looking to increase energy, but also plays a part there in that stress response. And then, of course, serotonin is the well-being, the happiness, also helps with feeling alert. So it's something we hear a lot in the depression space and the anxiety space. Also, interestingly enough, it does play a part in the management of pain. So it's something that can be utilized by neurology, by folks in different areas to help decrease pain perception. So sleep is made primarily through melatonin. Serotonin plays a part in that. And tryptophan is the precursor for both of these things. So tryptophan is an amino acid. It's found in various proteins. It has various cofactors to help change it. Again, no quiz, but help change it into precursor 5-HTP. And then from there, serotonin, and from there, melatonin. All of these, you might see these like magnesium, iron, B6, folic acid. You might see these in various multivitamins and various micronutrients in supplements. That's the kind of reasoning behind using them in different areas, is that they help with as cofactors in the creation of our neurotransmitters from their originating source. So this is one example of how that kind of can play out. And again, this is a very simplified version, but you can see how serotonin and melatonin are both coming from that precursor and need things like zinc and iron and magnesium and B6 to help them create the neurotransmitters that help us with calming ourselves, with improving our mood, with helping with sleep. The opposite of that is if there's a lot of inflammation in the brain, like we talked about earlier today. Stress of cortisol, steroids, but also inflammatory markers. It's those proteins, those cytokines that break down products when there's inflammation and an effort to heal. Well, they can also unfortunately break down the precursor for our neurotransmitters, tryptophan, and that leads to these waste products. You don't really need to worry about like what they're called. They're just ones that we don't want a lot of because they cause oxidation and just negative breakdown in our brains and just cause us to not feel very good. So how an unhealthy lifestyle, McDonald's, as my son loves to ask for every day, how eating like not anti-inflammatory food, processed food, not taking care of ourselves, drinking alcohol, using substances, all the things, how that can go from here I am just chilling on the couch to now I have inflammation in my brain and I don't feel very good. So basically, this unhealthy lifestyle, food additives, preservatives, toxins, pollutants, any kind of exposures. Uh, the gut is, though it's inside our body, it is connected to outside our body. It's when you look developmentally at the cell tracks, it's the same kind of cell tracks as the outside of our body. So when you have kind of a lifetime of low grade uh, inflammatory processes kind of happening in the gut, that affects the microbiome. So the microbiome is a group of bacteria that live within our gut, live on our bodies, and kind of helps us keep that homeostasis. Like they make products that help us digest, we make things that help them survive. So it's just something that kind of keeps us healthy. Um, and if there is inflammation happening, basically the inflammatory processes breaks down the microbiome, the protective gut barrier that keeps large molecules from going into circulation. Because if a lot of these chemicals, these uh, food products, these bacterial toxins, cytokines, if these things enter into the bloodstream, then they add to an inflammatory process. The microbiome helps create a film that keeps these things from entering. That, along with our own natural immune system, is going to help fight these things and keep them on the outside so that they can kind of move on through and be passed through the gut. Um, but if we have a lot of inflammatory processes happening, that protective layer is worn down. And unfortunately, then these not so great characters can come through, get into the bloodstream, break through that blood-brain barrier, and get into our nervous system and cause inflammation. That causes brain inflammation, autoimmunity that we see on the nerve level, neurodegeneration, and unfortunately, psychiatric disorders. This is really a lot of research is being done on this. This is a lot of what integrative psychiatry is about, is like trying to decrease this inflammatory factor that's happening. So in attention deficit, we have the balance of the neurotransmitters is kind of offline. So we have things like genetic predisposition, having more of an inflammatory lifestyle, like maybe smoking or being exposed to environmental toxins that aren't so great for us and maybe not the healthiest foods. Those things all add to oxidative stress, to inflammatory processes around the brain or in the brain. And that, along with genetic predisposition, can increase the likelihood that we're going to have difficulties taking the dopamine into our brain, helping us stay in a place of focus. And that balance gets out of sorts. And so that in itself can lead to having difficulties with attention. It can be as extreme as something like an attention deficit, but it can be less so. It can be a brain fog. It can be memory concerns that we see with anxiety and depression, that we see with having inflammation, that we see with having chronic illness. The extreme is the attention deficit diagnosed brain, but it doesn't have to be that extreme for it to have similar processes happening. And that's not to say you have to treat it with a stimulant. A stimulant is one of many ways you could treat it. It's oftentimes more beneficial and going to last in a better way to kind of go more to the building blocks and see, can you add cofactors? Can you add magnesium, zinc, other cofactors that are going to help the tyrosine, the precursors, make more dopamine, rather than the prescription, which just adds the dopamine and then it's out. Whereas if you are adding the cofactors, the precursors, the things that help build the neurotransmitter, then you're going to go more into a long-term improvement. So looking at decline, again, sometimes folks have a concern of dementia. Other times it's more of this mild cognitive impairment we see with inflammation. But there's the subjective decline, which you yourself may notice, and that's often due to stress, due to chronic illness, due to thyroid, whatever it may be. The mild cognitive impairment, others may be starting to notice. There's a change in performance and ability to do things. Sometimes, depending on the root cause, the person may or may not be aware of this. And then, of course, dementia is when it gets into the way of interfering with activities of daily living. And that's what, as much as we can prevent, we want to do things in this space so we can not get to that part. Just for awareness, as far as like different parts of the brain, again, if you're seeing a physician or medical team and they're talking about different areas of the brain, if they're imaging you for some reason, so you have some awareness of like what they're referencing. When we talk about attention, memory, executive functioning, that's that like part of the brain that like directs traffic and helps you make good choices. That's going to be the frontal lobe. Also personality. So that's the part of, like I was saying yesterday about teenagers not having that as well developed, because that's the part that's still kind of coming online. So, that's why impulsivity and things like that are not uncommon in younger people, because that frontal lobe, that executive functioning isn't fully online. The hippocampus is more about the memory encoding and trying to get things formulated and stuck around. The amplification and the limbic. Long-term memory is more in temporal lobe. Over 2 years, it's in multiple regions. And then, of course, the calibration, the coordination of memory, also coordination of body, is in cerebellum. So that's in the back of the brain. So cognitive decline, again, I have folks who often come to me and are worried about brain fog, about not feeling like they're thinking clearly, maybe not at the point of like an Alzheimer's, a dementia, or, at the point where we have to include neurology, but more in the, hey, I want to prevent this. I'm worried about it. Maybe I had brain injuries as an athlete when I was in college. Maybe I had a car accident and had a concussion, or maybe I just have some inflammation because of illness, and I'm now having some brain fog. It could be any of these things, but these are things that we consider as possible reasons. Like I mentioned early on, like hypothyroid, anemia, respiratory concerns, sleep issues. Folks often will come to me with cognitive complaints or concerns. They have attention deficit as an adult, like a new onset. I'm always going to look at sleep. And actually, we look at this in children too. Folks, sometimes I had a dear friend whose child looked like a classic case of attention deficit. Lo and behold, they looked at her tonsils and adenoids. They were huge, and she had obvious sleep apnea. Once that was taken care of, all the symptoms were gone. So these are things we want to consider rather than just jumping to, okay, I'm just going to give you a medication and see you in 6 months. So again, these are kind of the things that we can do something about in the here and now, versus as we get older and those processes have kind of already taken over. Not to say that we're just going to watch them and to be like, peace out, but then it's more of a management, more of a slowing down, whereas earlier on, it's things that we can do to prevent. So the hippocampus, remember that part of the brain is about creating memories and formulating memories. And it's a part of the brain that gets smaller with age and with dementia. So things that increase, when we say neurogenesis, it's that neuroplasticity, the creation of new neurons and making it bigger and making it stronger, is the exercise. Remember, that increases that brain-derived neurotrophic factor we talked about earlier today. Also, that in turn increases the volume of the hippocampus, so improves memory, engaging in active learning, coming to talks and engagements with community such as this one, and being in that stimulating social environment, interacting with people either live or virtually or whatever kind of you're able to do in the moment, whatever serves you. And then, of course, meditation. We know increases neuroplasticity, increases those areas of the brain that help with memory. Yoga is something that's often indicated for attention deficit. It's a mindful movement. There's a lot of evidence with the different types of mindfulness for different diagnoses, and this is just one to consider. The decrease of neurogenesis, the shrinking of that hippocampus, the negative effect on memory is going to be chronic stress. It's a big one that, people come concerned to me, they're getting demented when they're actually just really stressed out. And it sucks, but there's at least something you can do about it. Inflammation, eating all the McDonald's, not engaging in a healthy lifestyle, not taking care of yourself. Oxidative stress goes with that. Alcohol, an overuse of alcohol or just misuse can cause a decrease, a shrinking of that area of the brain that helps with memory. Brain injuries themselves cause that, as I said, aging does. And then sleep apnea. Again, this is a big reason I'm always harping on, can we do a sleep study? Can we look at what your sleep is? Can you talk to your family and see if you're stopping sleeping? It's an easy fix if you find that you have a sleep apnea. And it's something that can kill you if you don't treat it. So it's something worth considering and being open to, as much as people maybe don't want to look at that. So a healthy brain has, you're offering it, that healthy diet that we've talked about earlier, the different types of fatty acids that are healthy, the positive, adding omega-3 to the 6 that's already in the body, that Mediterranean diet, that's anti-inflammatory diet with uh, fish and beans and healthy vegetables and fruits, a little bit of red wine. Those things increase brain-derived neurotrophic factor, which increases growth in the brain, decrease the inflammation, and increase the ability for insulin to take in the sugar in the cells and use it appropriately rather than having it causing inflammation throughout the body. Exercise, again, is going to increase the volume and areas of the brain that control memory and help with mood, help increase neurotransmitters that help with focus and mood. Then, of course, as I kind of referenced, the polyphenols of vegetables and fruits, the antioxidants, that Mind Dash diet, those diets are going to be very beneficial in improving brain health. And of course, the reverse, the things that we want to consider if we're worried about our brain health is those like simple carbohydrates, the sodas, the processed meats. These are everything in moderation. Like, I'm not saying you can never have a Coca-Cola, but just consider that it may not be the best choice for you. The sedentary lifestyle, again, like, I've talked about, if you are one that has a chronic illness that maybe exercise causes you to have some downtime, that's okay. It's a matter of balance, but the temptation can be to not exercise at all because of maybe you overdid it and are still figuring out what your body can handle. So instead of giving in to the sedentary lifestyle, which will shorten your lifespan, maybe working with a physical therapist, with a coach, with someone that you trust, and finding what's a good balance for your body. What does your body respond well to? What can you handle? What is something you can build upon? What's something you loved doing when you were a kid that maybe now we can modify to help you do as an adult? And then, of course, the Western diet, the candies, the cakes, the Coca-Cola, the McDonald's that my son loves so much, all that unfortunately adds to obesity, adds to inflammation, and decreases your brain's ability to function well. So brain drive neurotrophic factor, as I said, it's something that is increased with physical exercise, with cognitive exercise, doing those brain exercises, using, doing the old crossword puzzle, doing Wordle, I think is another one. One of my brothers loves was a good Wordle. Social engagement, engaging with each other in our virtual group, engaging with each other in real life, seeing people that you care about, going to activities, connecting with others in whatever way that may be. All of those things increase brain-derived neurotrophic factor, which then increases things like myelin synthesis. That's the covering of the neurons that helps your nerves work well. So like when you don't have enough myelin, things like MS, things like um, uh, Lou Gehrig's disease, things like that kind of are associated with a lack of myelin or myelin breaking down from inflammation. Increased neuron branching, which allows for more connections and more new ways of thinking and being, and increased volume within the brain, improving the synapses between neurons, and then it's supporting the mitochondria is the powerhouse of the cell, as we say, and increasing or improving that ability to function is only good, and it's going to help support the development of new neural pathways and cells within the brain. So just touching again, I know we talked about this in our last session, that MIND diet, just so, some more specific examples of that and things that you can look at if you're considering moving more towards a MIND diet. Leafy green vegetables, having those at least 6 times a week. Other vegetables, at least a serving a day. Berries, 2 servings a week. Colorful berries, look at what's in season. You don't have to like spend an arm and a leg on these things. You can go to your local farmers market. There's co-ops. There's different food delivery services that that are plant-based or involve good, healthy, organic foods. Whole grains, at least 3 servings a day. Fish, at least once a week. That's if you can have more than that, even better. You can look at the environmental website to see like what fish has mercury, the different levels, if that's a concern and if that's something you've had a lot of exposure to. There's also poultry, if you eat that a couple times a week. Beans at least 3 times a week for the protein. Nuts 5 times a week. Nuts are great, like a trail mix or anything made with nuts, maybe dried fruit or what have you, is a great snack source that you can use instead of the candies and all the things that aren't so great for us. Sometimes we start craving until we train ourselves otherwise. If you do drink wine, I limit it to a glass a day, and that is very much dependent on what your body is able to tolerate. I personally can't even do that. Like that's just, it's not in alignment with my personal gut health and how I do. Like I'll have wine occasionally, but it's not something that I'll do daily. But that's just a matter of like what your body can tolerate and also your family history and what is healthy for you as far as those choices go. And then of course, olive oil is a great resource for healthy fats and good cooking. So that's one to always consider. So these are just comparing the different diets. The Mediterranean diet is that anti-inflammatory diet that you hear about. The DASH diet is for hypertension, so for high blood pressure, and then the MIND diet combines the two. So again, it's kind of more emphasis on the vegetables and nuts and fruits, and different colored fruits and grains. And then depending on like what type of diet, as far as how much of the different meats. Red meat is not as good for you as maybe the meat producers might have you believe. Not to say you can never have it, but it's definitely not something I would encourage every day. Fish is something you should really try to move towards if it's something that you enjoy, or seafood is, same difference. Olive oil obviously is good for you. Low fat dairy if you're doing dairy, and decreasing the amount of saturated fats. Obviously, we don't want the sugars and the sweets. Those can be, depending on the type of diet, they might be something that your dietitian is like, hey, you can have a little bit of this, but it just depends on the diet that you're following. And by diet, I mean like type of eating, not like diet to lose weight. I mean like your pattern of eating is what I mean by diet. Okay, so a lot of folks will come to me and ask about time restricted eating or intermittent fasting. And so this is the healthiest. I actually got trained and certified in circadian fasting, time restricted eating. And this, again, having studied with folks who kind of whose lifelong passions are the research in the circadian space. I can say this with some authority because I've heard it straight from the folks doing the research. This is the best way to eat. This is most in alignment with how your body is made. This is most in alignment with keeping a healthy metabolism. And especially for my women, you have to be very careful with the like popular like fasting for days. That doesn't do well with our hormones. And you have to be very aware if you're still having periods of like how your period health and hormone health goes with any type of restricted eating. For folks still having periods, I'd even like do the time restricted circadian eating more hours on the days that you're kind of having, around menses and stuff like that around your period, versus the days that you're not. And that's really, you kind of have to see how you do. So this is kind of looking generally at how the body works throughout the day. So waking up, your lowest body temperature is around 4 in the morning, 4:30. The blood pressure rises around 6:45. Which is interesting because if you're in the hospital, that's always when they're checking it. Melatonin stops being secreted around 7:30. Bowel movement usually happens then shortly thereafter. Testosterone tends to be higher in the morning. Alertness tends to be higher in the mid-morning. And then we hit that noon time. Remember, that early time is when you're having that circadian light. You're most coordinated. So if you're training for a marathon or training and dance or doing something, you're most coordinated in that mid-afternoon range, and you're most likely to have a good reaction time in the 3:30 time period. And then cardiovascularly, you have the most efficiency and strength around 5. Blood pressure tends to be highest around 6:30. You have the highest body temperature around 7, and then melatonin starts around 9. So, uh, people ask me about when to take melatonin if they're taking it themselves. And that's why I say, like, up to an hour before bed, but taking it earlier is totally okay because biologically that's what's supposed to happen. Bowel movements get suppressed around just before midnight. And that's because there's melatonin receptors throughout the gut. And that's why circadian time restricted eating is something that's so in alignment with how our body works, because our body is naturally making that melatonin at night. The receptors in the gut are for melatonin, and so that suppresses digestive uh, movements and absorptions and what have you in the nighttime. So eating at 2 a.m. is not in alignment with that. And that's one of the biggest mistakes we make, I think, in the industrialized world, is this late night eating. So circadian fasting is basically combining this science of the time restricted eating with the science of circadian biology. So it allows for mental, physical, behavioral changes that follow this daily cycle. So this is, it's not just about the eating, it's about using the daylight, using our interaction with earth and with the environment in the healthiest way to help us feel our best selves. So potential benefits is a reduction in body mass index. That's how we, kind of look at how much fat is in our body versus lean mass. It's considered therapeutic for folks with diabetes type 2. So this is something that would be often prescribed to you if that's something that you have in your, that your body's flirting with having, or you have issues with. It does lower and improve markers with heart disease. It improves blood pressure. It reduces metabolic issues, and improves, regulates inflammation. So there's so many positive aspects, and it's really not. I mean, the training of doing it and kind of changing your behaviors is hard, but honestly, intuitively, it's not that hard. So the best way to begin is to try fasting for just 12 hours. Because again, we have a tendency in our world, our part of the world, to eat late into the evening, maybe start eating too late, and eat late. And people will try time restricted eating and say, oh, I'm just going to skip breakfast. That's actually the worst way to do it, because eating late into the evening is actually not good for your body. And when you skip breakfast, you're more likely to eat more later. So actually, when you compare the different types of time restricted eating, or types of fasting, those who skip breakfast are actually more likely to have issues with diabetes type 2 and with metabolic issues in the long term, versus those who move up their eating pattern and eat earlier in the day. So the recommendation is to stop eating before 7 or 2 hours before bed if you're kind of going to bed a little later, and get daylight for a few minutes, as much as you can. 20 minutes is preferable before 10 in the morning if possible. And try eating organic, whole foods, limiting the processed foods, adding those healthy fats, those things we talked about with the MIND diet, that the nuts, the seeds, the fruits. Drinking water throughout the day and teas, electrolytes if needed to avoid dehydration. This is especially important for my folks with hypermobility who have dysautonomia. Um, Stop electronic activities at least an hour before bed. I mean, it's funny because of like how I do it, but I have Alexa tell my family to turn off our electronics at 9 o'clock. Which it's funny because it's Alexa doing it because it's like literally an electronic telling us to turn off our electronics. But I've noticed an improvement in getting everybody down when we do that. Going to bed before 10:30 and waking up, earlier in the morning is the best if that works for you, but you have to listen to your body and see what works best for you. If you can do a fasted workout, that's going to improve the positive effects of circadian fasting even more. But this is only if you can tolerate it. You have to listen to your body. You have to work with your dietitian, work with your providers, your physicians, and make sure that's something that works for you. Like if you're, on insulin and dealing with diabetes, you have to kind of consider all the factors, right? But if it's something you can, that does increase the positive effects of fasting, the body's ability to get rid of bad, precancerous cells, the body's ability to use up fat stores. All those things are improved if you're doing a fasted workout. Of course, we always recommend some type of meditative practice. It can be a mindful, like we did this morning, a mindful writing. It can be journaling. It can be a breathing practice. It can be a mindful movement. It can be a prayer practice, any type of practice to help stimulate that parasympathetic, that relaxation response. So the fasted workout, I touched on this a little bit already, but improves insulin sensitivity. So your body's going to take up that sugar much more effectively into the muscles rather than having it hang out in the bloodstream and causing a havoc. It's going to help the body burn more fat and helps with metabolic switching, which means turning from using just the sugar in the blood to using fat stores within your gut and areas of the body that you really want to get rid of those fat stores. It also helps genes, helps with using fatty acids in a positive way and creating the different hormones that we need. It's ideal to use if you are open to it and if it's something that's in alignment with your body. Those short duration workouts, aerobic training, those are ideal if possible. Again, do what works for you. If it's walking for 10, 20 minutes, that's a great place to start. It also helps with what we call autophagy, which is what I was kind of alluding to before, where the cells, your immune system eats up the bad cells, the cells that are precancerous, the cells that are causing issues in the body in the long term. So that actually is improved with this fasted workout as part of your regulation. Excuse me. Okay, switching gears a little bit. Medications and brain health. So like I said, a lot of people come see me as an integrative psychiatrist because I'm in the space of working comfortably with traditional medicines and supplements. And a lot of people realize that the traditional medicines they're on aren't working well for them in their brain health. They see the side effects and they want help decreasing them or stopping them if possible. So these are some of the cells that have the most impact on brain memory. Excuse me, I'm so sorry. Okay. The benzodiazepines are unfortunately notorious for terrible effects on brain function. As we get older, our metabolism slows, so these are actually in our body for even longer periods of time. They decrease our ability to have neuroplasticity. They decrease our memory. They also decrease our body's drive to breathe. So our drive to breathe, I'm sorry. So if you are on a benzodiazepine or a hypnotic for sleep and have like a flu or COVID or something like that, you can actually develop something much more severe because of that interaction. Antidepressants, specifically the tricyclics, because they work on so many different neurotransmitters, so they kind of a little messier than the newer antidepressants, cause issues with memory. Painkillers, I've mentioned this earlier in our 3 days, that they suppress everything. They suppress PTSD, they suppress mood, they suppress feelings. And so that includes memory. So unfortunately, when you're on these things, it's really hard to learn. It's hard to remember. It's hard to do well cognitively. Some of the hypertension drugs, the beta blockers, can affect your memory. So it's just something to be aware of if you need them for blood pressure. I'm not saying to stop them, never. You definitely need to, kind of monitor that with your doctor, but it's something to be aware of if you are dealing with memory concerns, and maybe that's a newer medicine for you. Like maybe there's a different type of medicine you should be talking about with them. Sleep aids are unfortunately notorious for this. They decrease, I always tell people if I prescribe them, which I don't do really anymore, but I help people get off them now. But when I prescribed them back in the day before I had other tools, before I had learned integrative medicine, I would always have to explain not to have any conversations with anybody when you're on these medicines, because you will not remember them the next day. And I'd have to tell the spouse or loved one, like, don't get in an argument with this person, or don't have that important conversation. Don't tell them to do something the next day, because it's not going to be available to them. So, students like ask for sleep aids and then they can't perform on tests because they don't remember anything they studied. They just really aren't great. They're not meant to be used for more than short term because of their qualities and because of how this can have an additive cognitive effect. But unfortunately, things kind of evolve in a way that isn't always healthy for us as far as prescribing practices. The anticholinergics, those are medicines used for COPD, used for asthma, used for overactive bladder, incontinence, overactive bowel, dizziness, motion sickness. These medicines all have a place for what they are being prescribed for. But again, I'm not saying to just stop them tomorrow without talking to anybody. But if you're recently on a medicine for one of these things and you're noticing some brain fog, talk to your doctor, to your pharmacist, to whomever is prescribing. And if they don't realize that's the issue, maybe talk to someone else. Like that, that could be a big contributing factor. So you need someone who's going to be open to considering other options. So with the opiate use, I just want to, because opiates unfortunately have become more of something that we need to be concerned about and monitoring. The chronic opioid use actually can lead to more pain perception. And this is, again, getting back to that homeostasis of the body. When we add a medication, your body doesn't just go, oh, cool, now I have more serotonin. It like decreases the serotonin receptors. Like it's cool, I have more of, this medicine that's going to decrease my perception of pain. Okay, well, I'm going to make more pain receptors because I need to keep it in homeostasis. So when you start a pain medication, your body creates more of the receptors, more of the inflammatory processes, all of these things. And so the pain itself is actually worsened with time. And that's part of the addictive qualities of opiates. That's why they're so hard to get off of. That's why we have to, use other things, other plants and other things that are available to us to get off of these things. And that's why they're time limited. That's why you don't want to be on them chronically, because unfortunately, in the long term, inflammation is increased, and it's just pretty negative as far as outcomes. Alcohol. So, I live in New Orleans. We love a good festival. We love anything that involves alcohol. I'm saying the royal we, because I'm not, like I said, myself, I don't tend to drink a whole lot, but binge drinking specifically leads to an increase in cortisol. And then cortisol is the stress hormone. So over time, if you look at a light drinker is this dark line, and then the heavier drinker, and you look at cortisol level over time by dose, if you're looking at just the placebo is just, a time in minutes over the amount, it's kind of the cortisol, the level that goes down. When you go to being a low, like a light drinker, it also goes down. When you're a higher drinker, the cortisol level is going to go up. So Basically, the more, 4 drinks cause elevated cortisol in light drinkers and no elevation of cortisol in heavy drinkers. So basically you have a lack of drive, a lack of ability to like respond to things. So it's kind of like you poop out if you're a heavy drinker, and when you're a light drinker, you get super stressed. So neither of these are really a great thing. But the stress response is definitely increased when you're doing that kind of drinking for longer periods of time. So, cannabis use, as I mentioned the other day, marijuana has been medically approved for various aspects. It works well for pain. It doesn't work so well for things like trauma. We actually see negative effects with it. And chronic use of cannabis, especially of the grades that we have these days, these aren't like, this isn't your grandma's cannabis. This isn't like Woodstock cannabis. This is like much higher strengths and potency. And unfortunately, that chronic use is seen with impairments in 6 different neurocognitive domains, including memory, cognitive impulsivity, cognitive flexibility, and attention. And we see this, like people will come to me and they're dealing with feeling low, having memory issues, having difficulties with thinking, having difficulties with attention, having difficulties with motivation. And that's the one change that they don't make. And unfortunately, we don't see a lot of improvement. There's only so much we can do when this is on board, kind of adding to this negative aspect. And again, it's not to say that it's not helpful in other areas. Like it does help with pain, it does help with sleep, but you have to be aware of what can happen if you overuse or are just using it socially. Caffeine, another one that kind of has positive and negative aspects. So caffeine is super great for memory. We recommend it for helping with Alzheimer's. It helps improve memory. It helps be anti-inflammatory. It helps with decreasing oxidation. It helps with improving all these different aspects of decreasing the Alzheimer's process and development. But the negative aspect of caffeine is that it also increases cortisol. So you have to have a balance. If you're kind of drinking 8 glasses or 8 cups a day into the evening, the cortisol is increased during the day and into the evening. And remember, cortisol is what keeps us awake, and melatonin helps us sleep. So cortisol's high, melatonin is going to be low, and then lo and behold, it's 1 a.m. and you're wide awake. So this is, and also the stress response that goes with the fight or flight, and those things have their own negative consequences. So it's a balance. It's none of these things are things to never use. It's just a matter of balancing them. With the high cortisol, unfortunately, that's the neurotoxic effect that can lead to more stress, more development of the peptides that we see in Alzheimer's development. So that's chronic stress. That's that stress response we started talking about on day 1. That's just another reason to engage in this mind body work and the different things we're talking about today and over the past few days. So when we're looking at inflammation of the brain, it starts out with the brain fog, hazy thoughts, like, I'm not really sure, did I do that? Did I not do that? Getting fatigued after periods of time, goes to the moderate, where you see more of like a mental health concerns, like an actual depression, lethargy, loss of motivation, appetite, engagement with life. And then of course, severe is when we get more into like the delirium, the dementias, the folks that I share with my neurology colleagues. So the nutraceuticals are the different types of plants and supplements that we'll use to help with brain health. Things that help with focus are things like caffeine, that in green tea, memory, has the huperzine, the alpha GPC, the endurance with the media length triglycerides, medium chain triglycerides, the ginkgo. All of these things help with cognitive function. And then, of course, there's the preventative, which I'm a big fan of, like, rather than chasing our tails, let's try not to get there where we're chasing our tails. The vitamins, minerals, fish oils, the different things that happen with a positive anti-inflammatory diet, but also the micronutrients and things that I'll prescribe to folks when they see me. I'm not going to go through these like, you know, in detail, but this is just some generalized idea of like what I'm talking about when I'm saying things like micronutrients and things like that. Um, there's the positive fats, DHA, the medium chain triglycerides, the ketones. Those are all used to support brain health when we're kind of in a recovery state. The nutrients that help us with proactively avoiding or decreasing brain concerns. Same with the antioxidants and flavonoids. And then, of course, the botanicals that we'll use in different ways, whether it be adaptogens or other types of plants to help with support and with brain health, general brain health. Psilocybin is um, uh, one of the substances that are being explored now in the western part of the country and in different, I mean, they've been in the know. Paul Stamets is a known researcher in mushrooms and psychedelics. He has what's known to those who are kind of in that space, the Stamets stack, which uses psychedelic mushrooms along with things like lion's mane and other like pro brain health uh, mushrooms. He has a website, themicrodose.me, if you're a microdoser or someone who's considering microdosing and just wants more information. He has research that he does with folks who voluntarily go into this website or into this app and do different types of finger tapping and things that tell us about likelihood of developing things like dementia. And we've seen improvements. This is data still being kind of created and put out there, but he's seen his hypotheses is that it helps improve brain health, it helps improve neuroplasticity, and some of these tests have shown improvements in tests that normally indicate Alzheimer's. So lots of positive things happening with the psychedelics as far as brain health. As I said the other day, they do the same brainwave pattern as meditation. So it's really like meditation times 20. And so the psychedelics are something that are kind of up and coming. So far, we've seen the positive aspects of them when you're doing them in a safe um, environment with like a assisted therapy with someone who has an actual guide who can help you safely get through them. The flip side of this is the ketamine use without these kind of things in place. I've had a lot of folks have negative aspects with that, unfortunately. So you really have to make sure if you're kind of engaging, and ketamine is not a psychedelic, just FYI. But if you are engaging in this kind of space, just be careful that you're working with someone who actually is either a researcher or someone who actually knows what they're doing and not just someone who's kind of using it for an easy buck, because unfortunately those places exist and it's unfortunate, but I see the fallout of that every day. So this is something to keep an eye on, something that I'm keeping an eye on, and something that I'm excited to be able to offer in the future when it's more regulated and available. Just a quick note, as far as like the psilocybins, the mushrooms, 100% of folks with asthma have allergies to the the seeds of these things, so the spores. And so a big part of kind of making sure you're getting it from a regulated source, and preferably from somewhere where their legalities are in place to keep it safe, is because even Paul, who has been doing this for decades and has a very close-knit network of folks that are using them together, has had friends die uh, who know better and who do all the right things because there's spores in whatever sampling they got, and they had allergic reaction and unfortunately died. So just some awareness. I always want you to stay safe, but it is exciting on what's coming in the horizon once we get to a place where we can kind of do that in a safe space. So for kind of back to if you are dealing with brain fog, if you're dealing with brain injury, if you're dealing with just brain recovery, just noting that when we have demands on our brain, we're using up fuel. The brain can then fatigue, and when that happens, we can notice a loss of focus, attention, inability to concentrate, poor memory. That's a time to supplement if you need to with the medium chain triglycerides like MCT oil with ketones if you need to. Like, this is if you have severe brain injury, but it's something to notice if you are starting to get into that space. If you're kind of dealing with the fatigue, one way to kind of immediately help yourself without having to go to that extreme of then needing to like intervene with ketones is to decrease your cognitive stimulation, decrease your sound stimulation, your movement, light, get into a dark room, eyes closed, if you need to do earplugs, and just allow yourself to recover. This is, again, if you're in a space of like having some cognitive concerns with brain fog, with brain injury, with long-term COVID, what have you. These are all spaces where this would be beneficial for you. And when we talk about those deprivations, things that you can try if you're, again, kind of needing space for brain recovery is earbuds, noise canceling headphones, tinted sunglasses, dark rooms, and of course that getting to like the weighted blanket, the eye patch. If you're able to go to a place with gravity deprivation, awesome. But if that's not available to you, there's like the poor man versions. So having that recovery time, oftentimes you'll need, 20 minutes of sound canceling, noise canceling, light canceling, and avoiding things that are going to cause more fatigue for your brain. It's so easy to just start going to scrolling or, watching TV and things like that. If you're really having some brain fatigue, you need to kind of avoid those things for a period of time. All right, so to the fun and always exciting adaptogen. So like I mentioned to you guys before, the adaptogens play into reversing the stress response. So stage 1 of stress is when we're really in that kind of anxious, fight or flight, like unable to kind of turn things around for ourselves. Maybe there's a lot of anxiety, not able to kind of settle ourselves. Something that I might use there is like a holy basil. Again, all of these different plants and adaptogens have different elements, different qualities that we use depending on the person and their needs. But like a holy basil is going to be more calming. It's going to give you the energy, but without like overdoing it. Stage 2's like really more into the like really kind of getting like in a PTSD kind of space or in a like not able to sleep, not able to settle down, like really extreme. And that ashwagandha is super great for sleep, super great for brain restoration. Ashwagandha itself is used in India for Alzheimer's treatment and prevention. It's also used for back pain. It's used for PTSD, used for anxiety. So I will often recommend that either in combination or by itself at bedtime for folks who are kind of more in that trauma space. And then, of course, there's the stimulating adaptogens. If you get to the later stages of chronic stress where you're just kind of pooped out and not having a lot of motivation or ability to move forward, ginseng is known for helping with brain health and memory and kind of being more stimulating and energetic. And then the rhodiola is from the rose family. It's an opening. It allows support, allows more an improvement in mood and energy without kind of overdoing it. It is one to be aware of if you're kind of if you're a mood disorder person who is like an undifferentiated mood disorder or tends to move into an anxiety space or a manic space, rhodiola may not be the best fit for you. So that's, again, a good reason to kind of partner with someone like myself who's kind of familiar with your story and what is going on in your life in this particular moment, because there's different elements to different types of adaptogens. So it's similar. I mean, I liken it, I guess, because I'm in the psychiatric space, to like how we have the different antidepressants. Like they all generally do a similar basic function, but depending on what the person's needs are is the different type of antidepressant we like move towards like, oh, this one helps more with sleep. This one helps more with helping you have energy. This one helps more with your appetite. So similar to that, the adaptogens also have different qualities, different organs that they might support. Like this one helps more with the liver. This one helps more with heart opening. This one helps more with kidney function. And those things, whether it be in traditional Chinese medicine, Ayurveda, or just from our Western world, all have different functions that we're looking at and considering when we decide what might be a good fit for you. So again, if you're kind of looking at the adaptogens, thinking that might be something cool to try, I recommend reaching out. I do have a consultation for folks who are just looking for integrated medicine. You don't have to be looking for psych to kind of talk that over with me. Other supplements that I strongly consider for brain health, lithium orotate is a type of lithium. Lithium citrate is the one that you hear of for bipolar disease or disorder, I should say. Orotate is the salt that is found in some water supplies. And if you look at a map of America, where lithium is in the water supply has the lowest rates of suicide attempts and successful suicides. So lithium is known to be something that lowers suicide rates. It's known to be protective of suicide. That's something that citrate has always been known for. It's one of the classic things we learn in psychiatry. Orotate, that's also true. It's also been found to lower Alzheimer's risk. It actually works to break up the tangles and the different proteins that we see in the brain with the development of Alzheimer's. So pretty cool anti-inflammatory thing that it does. Turmeric, is another anti-inflammatory. Turmeric is highly recommended to use in your cooking. If you do use it in cooking, add some black pepper to make it bioavailable to you. A little bit goes a long way. It's anti-inflammatory. It also decreases inflammation in joints and body and pain, but also decreases inflammation in the brain. It crosses the blood-brain barrier, so it's something that's worth considering and helping with memory, brain function, brain fog, but again, also pain and general inflammation. Other symptom management, magnesium, when someone has anxiety, difficulties with sleep, difficulties with regular bowel habits, difficulties with diabetes, blood pressure, menstrual pain, all these things tell me that magnesium isn't at a good level. And there's different types of magnesiums that we use. And if any of those things sound like you, then magnesium is probably something your body is lacking. L-theanine is a protein in green tea and causes a calm alertness. So it helps with focus, but also helps calm down the brain with anxiety. So I'll use that with folks who need help with focus, but I also can use it for folks with insomnia. It's kind of got both elements that are able to be used. So that's always one that's kind of fun and cool to consider. And then of course, melatonin is an anti-inflammatory in itself. So it helps with sleep, but then it's such an anti-inflammatory and antioxidant that if someone has, if they're on a specific type of medicine that decreases melatonin, or they have a history of cancer or certain types of inflammatory processes, we'll actually recommend a higher dose of melatonin. Generally, if you're not in that category, we just say like 1.5 to 3 milligrams of melatonin to stay in the space of what you naturally would occur in the brain. Because higher than that, if you're not in the space of someone who needs it for treatment, it's going to put you to sleep all day. Like you're going to have a major hangover effect, and it's going to kind of be counteractive, and that you'll be too hungover to think straight. So not helpful. And unfortunately, a lot of the melatonin that you get in the drugstores is like 5 or 10 milligrams, which is way higher than you need. And so folks will say to me, "Oh, that doesn't work for me. That makes me a zombie," and that's because they tried like the Walgreens melatonin and not the actual like medical grade that we, would recommend at the more biologic levels. So for your home practice, you guys are all getting this practice sent to you. I just some ideas of how to bring peace to your brain, bringing pleasure, with how to bring some more dopamine without maybe the addictive qualities that can go with that. Mindfulness, things that help you with focus, things that are short term, and just being aware as far as the addictive things. The happiness of serotonin, looking at purpose, looking at things that are long lasting and help you stay in the moment. That prefrontal cortex of the brain is helping us analyze and kind of stay in the moment, and all these things help with improving that. We want to decrease that cortisol, that fear response, that stress, scrolling, staying up and looking at our phones, eating all the inflammatory foods. So ways that we can kind of improve the good things and maybe decrease the others is, getting our electronics out of the bedroom, limiting our phone apps, maybe putting, there's different settings you can put so they're not as available to you. Um, Decreasing ultra processed foods, raising serotonin by scheduling gratitude. There's gratitude journaling is a super fun way to improve happiness. It's one of the happiness practices that the folks in Berkeley who study happiness recommend. It's just every day taking 3 things that you're grateful for. Maybe before you go to bed, you could do this in your journal and noticing, like, I'm grateful for my dog coming to greet me at the door, and then take the next step of noticing why you're grateful, maybe writing that down as well, because that means he supports me and loves me, even if I've had a bad day, even if I don't feel so great about myself, he's still there for me. Writing both things down helps you not only take note of those positive things, but then with time, your brain starts noticing things to be grateful for. And we are all programmed to notice and take note of negative things because that's survival, but unfortunately it doesn't help the psyche very much. So taking notice of positive things, writing those down, having some gratitude around them, it's going to help with overall outlook and improve serotonin and give you a positive dopamine surge versus some of these addictive quality dopamine surges. So with that, I hope this served you. I'm always available to reach out to, email. Uh, if you want to make a discovery call, like I said, those are free, available to you with the code THRIVE through the Dara Wellness NOLA site. Just reach out to me with any questions, any concerns, any back and forth. I do, again, have consultations available internationally. I have ones available as like an intake and a follow-up, or the ones that I kind of enjoy are the 6 months of being a member of my clinic and my community. And those include either just you and I, or if you have a provider at home, if you're not in a state where I'm licensed or getting licensed, that you want me to coordinate with, that's another option. But I really enjoy doing those consultations. It's actually probably one of my favorite things to do, is to help people get back on track and feel good and get back to their best lives, so that when they come down to New Orleans for Mardi Gras or whatever festival and come by and say hello, I can see on their face they're just living their best lives. And knowing I have a small part in that really fills my cup. So I appreciate all of you. Thank you for tuning in and being with me today. And I look forward to our next time together. Take care.